Thank you very much. It is a pleasure to be here with you today. First, to celebrate really the successes that we've had already in global NTD control by Koreans in Korea, as well as increasingly Koreans elsewhere in the world. And second, of course, to recognize that there are big gaps that remain, and there's a need for us to discuss together priorities for further action. As has been mentioned, I'm a health economist, and I work in principle on all 17 of the neglected tropical diseases. So I need to admit that I'm not an expert in any specific disease. Fortunately, there are many people here that have expertise in the individual diseases. But what I hope to provide for you today is an overview of the NTD portfolio, the neglected tropical disease portfolio as a whole. Now, as many of you know, the NTDs include, in fact, 17 diseases as defined by WHO. These are medically diverse diseases, including helminth infections, protozoan infections, bacterial infections, viral infections. These are diseases that are, what they have in common, these diseases, is that they mainly affect populations living in poverty with inadequate sanitation, people in close contact with domestic animals and livestock, and infectious vectors such as mosquitoes transmitting these diseases. They perpetuate poverty because they impair the cognitive development of children. They cause chronic morbidity and disability, and generate also social stigma. They remain neglected. We have made a lot of progress in removing the neglect, but they remain neglected in spite of the fact that they put at risk more than 1 billion people. 1 billion people living in more than 120 countries, primarily in tropical and subtropical areas of Africa, Asia, and the Americas. And as we see, there are many countries that are afflicted by more than one, in fact, multiple of these diseases. The NTDs remain neglected also in spite of the fact that we know what needs to be done. There are 5 basic approaches. Expansion of preventive chemotherapy, also known as mass drug administration, that is treatment of entire communities. Intensified case detection and case management, which is the mainstay of the health sector. Improved vector and intermediate host control, so controlling those insects primarily that transmit the disease, as well as veterinary public health measures, that is treating these diseases in animals to prevent their occurrence in humans, and of course provision of safe water and sanitation. These 5 approaches are sufficient, the international community believes, to lead us to the elimination or eradication of 11 diseases by 2020. And I won't go through the 11 diseases now, but I do want to highlight some of the progress that has already been made on some of these diseases, and then I'll go on to mention or highlight some of the remaining gaps. Trachoma or guinea worm disease is targeted, one of the few diseases, one of 3 in fact, that WHO has targeted for eradication, that is worldwide elimination. And we see a really dramatic decline since even 2008 in the numbers of cases. Last year there were only 127 cases of guinea worm disease, and so far this year there are only 8 cases reported so far. I think the slope of this graph really serves as a reminder of how much can be done with relatively simple interventions in a relatively short period of time, as long as there's adequate financial and political commitment. It is arguably one of the most high-profile stories in recent NTD control, given that it is being championed by former U.S. President Jimmy Carter, but there are other success stories. Human African trypanosomiasis, there's been extraordinary progress in HAT, or sleeping sickness as it's more commonly known. In 2014, the number of new cases dropped to fewer than 4,000 annually for the first time in 50 years. So we're on track there for elimination. Elimination of visceral leishmaniasis in Southeast Asia is we've also seen tremendous progress in Bangladesh and Nepal. Bangladesh having implemented a comprehensive program of treatment, of early detection, treatment, and vector control, controlling the sandfly that transmits the disease. There are ongoing challenges in India, but it seems, again, that the world is on track to, for regional elimination in Southeast Asia of visceral leishmaniasis. Preventive chemotherapy or mass drug administration. There are 5 diseases that for which the current strategy is based primarily on preventive chemotherapy. These include lymphatic filariasis, onchocerciasis, soil transmitted hemoptysis, schistosomiasis, and trachoma. So the red bars here in this graph indicate the targets that exist for these different diseases in terms of coverage. And then the blue lines show some progress in scale-up of coverage of populations with preventive chemotherapy towards 2013, which is the latest available data. So we see progress in general. You might note the decline in 2013 in lymphatic filariasis, which is driven by one state in India, and they are back on track in 2014. Onchocerciasis, that decrease in 2013 should not be interpreted as a step backwards. It is, in fact, reflects the fact that the onchocerciasis community is now targeting a larger number of people for preventive chemotherapy as they now move from a control strategy to an elimination strategy. STAs, schisto and trachoma, a bit more a longer road ahead, perhaps, in terms of scaling up coverage to the targets that are thought to be necessary. So the idea is that if coverage is maintained at these target levels for an adequate number of years, we can start to scale back in terms of preventive chemotherapy as these diseases are eliminated from specific areas. But you'll see, I wanted to put this graph up because it demonstrates the gap that exists in terms of the number of people requiring and those receiving interventions against NTDs, in particular preventive chemotherapy, which I've separated now by income groups. So you have the low income, lower middle income, and upper middle income countries, where the dark green line above indicates the number of people requiring these interventions, and the lighter green line below indicates the number of people that actually received interventions since the year 2000. And there are 2 things to note here. One is the very high number of people that require intervention still against NTDs. We're talking more than 1 billion people. But also that the gap between those requiring and those receiving remains very large in in middle income countries, and indeed specifically in the lower middle income countries. If we can close that gap, what we expect to see happening beyond 2017, in fact, is a beginning decrease in the number of people that require interventions. So that by 2030, you would have, as a result of successful elimination and increased control, you would have upwards of a 90% reduction in the number of people requiring ongoing interventions. So this is a very hopeful story. There is light at the end of the tunnel, as we say. We can make significant progress in the very near future, and thereby, in fact, scale back our operations and invest in other interventions. So we have those targets, and for the first time now, in February, we launched an NTD report that attempts to quantify what investments are required to achieve those targets. And we are bringing all of the NTDs together within the discussion of the Sustainable Development Goals and universal health coverage. We put all of this together under the heading of universal coverage against neglect, or universal coverage against NTDs. And it's estimated that, excluding the vector control component, which I'll go into in a moment. About 750 million US dollars are thought to be targeted until 2020 to scale up, in particular, the preventive chemotherapy interventions. And this is a significant increase over the current level of 300 million US dollars that is being provided by major international donors. When you include vector control for Chagas disease, chikungunya, and dengue, investments are significantly higher. So that's a point we made in this report, that the NTD community continues to focus very much on the preventive chemotherapy side. But it is clear that vector control for dengue, in particular, and Chagas disease will be significant in the coming years, particularly as dengue is a re-emerging NTD in the context of climate change. So increased investments are required there, but even for the vector control interventions, we can expect a decrease in the investments that are required after 2020. I won't go into the details of this, just to say that in the NTD report, as I said, we laid out investment targets for different areas. So including preventive chemotherapy, active case finding, other treatment and care. I just want to highlight the one example here as one of the gaps, and that's yaws eradication. So I mentioned earlier that there are 3 diseases targeted for eradication by WHO. One of which is guinea worm, one of which is polio, as I'm sure you know. And the third, many of you probably may not know, is yaws, which is targeted for eradication by 2020. And it's the one area where currently there are no major funders involved, which I'll go into in a moment. Just a brief overview. Yaws is a disabling and disfiguring disease found primarily among the really poor and most isolated communities in warm and humid or tropical areas of Africa, Southeast Asia, and the Western Pacific. It's caused by a bacteria related to syphilis, but it's transmitted primarily among children. And it's in its late stages, as you can see from the photograph. It has a fairly severe it's associated with fairly severe disfigurement of the face, also of the lower limbs. So WHO's strategy for eradication of yaws is basically a single dose of azithromycin. And currently we're in negotiations with the pharmaceutical industry to secure donations of azithromycin, similarly to what has been done for other NTDs, including azithromycin for trachoma. You'll see that treatment with azithromycin, the results are impressive. Pilot projects have been undertaken in Congo, Papua New Guinea, Vanuatu, Ghana. And it's been estimated that it would cost about $26 for each additional year of life that would be lived without the disability and disfigurement associated with yaws. Donations of azithromycin would reduce the cost even further, and so it is believed that eradication could be achieved in the 13 known endemic countries with as little as $100 million over the period of 2015 to 2020. I just want to say a few words about the Sustainable Development Goals. So for the first time, as was mentioned earlier, the NTDs are now explicitly mentioned on the development agenda. Under Goal 3, which is about ensuring healthy lives and well-being for all, Target 3.3 calls for the end of the epidemics of AIDS, TB, malaria, and now neglected tropical diseases. WHO has proposed an indicator by which to track this, which is the number of people requiring interventions against NTDs. Currently, that has not been included in the latest draft of the monitoring framework for the SDGs. So we're encouraging all participants, basically national statistical offices from the UN member states, to reconsider inclusion of an NTD indicator, so that we have something concrete by which to measure our progress towards the target of ending the epidemic of NTDs. But in addition to Target 3.3, which is of course the main one, since it's the one that specifically mentions NTDs, we're also very much focused on Target 3.8, which is about achieving universal health coverage, including, according to the language of the outcome document, access to safe, effective, and quality essential medicines. So the link to providing medicines, preventive chemotherapy, to populations at risk is clear, and indeed WHO has proposed a so-called tracer indicator related to coverage of preventive chemotherapy for neglected tropical diseases as a way by which we can measure how pro-poor, how equitable progress towards universal health coverage is, making sure that the poorest are not left behind as countries, increasingly middle-income countries, move towards universal health coverage. Of course, the other major goal that is related to the NTDs, and I'm happy that there will be a presentation later on water and sanitation, we're also excited to see the targets related to Goal 6, about achieving universal and equitable access to safe and affordable drinking water, and sanitation and hygiene. And again, here the idea is that NTDs will be used as sort of a tracer or a proxy for equity in the progress made towards these goals, so that coverage with water and sanitation will be measured in districts that are endemic for NTDs, to make sure that these communities are targeted first for the provision of safer water and sanitation. Related to that, and I mention this only because I think it's a neglected area of the NTD community's work in controlling these diseases, is this WASH component. So a new WASH NTD global strategy will be launched at World Water Week on the 27th of August. And it recognizes really that this coordinated approach is needed between the NTD and the WASH communities. So there's more detail in there. I highlight it only as an opportunity for further investment and further focus. So I will conclude there. Of course, with 17 diseases and more than 120 countries, I didn't hope to list out for you all the gaps and priorities. And indeed, I think that's something that is up for discussion. And I look forward to that discussion. I think this is a very important first step towards that. And certainly WHO will do anything it can to work with Korea and KOICA in particular, as it looks to expand its activities in the NTD space. And I certainly welcome the message that NTDs are neglected no more by Korea. Thank you very much.
네, 발표 감사드립니다. 크리스토퍼 피츠패트릭 박사님께서 국제적인 NTD 컨트롤과 엘리미네이션의 현황을 말씀해 주셨는데, 많은 NTD의 노력이 기니웜이나 그리고 레슈메니아 같은 경우에 보듯이 저희가 많은 개도국 원조를 위한 노력이 사실 무의로 끝날 때도 많지만은 많은 파트너들이 협력해서 노력을 할 때 실제로 이러한 감소에 효과를 가지고 오는 것들도 있을 수 있다라는 점들을 상기시켜 주신 것 같습니다. 그리고 앞으로 NTD와 관련된 많은 협력에 저희들이 참여할 수 있는 기회가 되기를 바랍니다.